About 40% of people are suffering with a tension type headache on any given day. This number is far too big, and people are starting to feel like it's normal. So if that's you, we are here to give you some things that you can implement right now at home on your own to eliminate your tension type headaches and keep it gone for good. I mean, let's face it, in today's world, it's hard not to get a headache. It's really, really stressful. Our muscles get really, really tight in our neck and shoulders, and this causes us to have tension type headaches. In addition to that, we tend to be in a fight or flight response on a regular basis. And what happens when we do that is that we activate these muscles up here. These are your accessory muscles of respiration. And so when you're in fight or flight, these automatically activate to be able to help you run away from the bear, right? So when we activate these muscles and we're using them to breathe, they're being overused, which means they get tight. So one thing that you can do right now, if you're like, hey, I feel like I do use these muscles for breathing when I feel like I shouldn't be, is to go check out our breathing sequence of videos, because it is really helpful to decrease your tension overall, to get your diaphragm moving correctly and not overusing these muscles. But if that's not you and that's not your problem, you may be wondering what is contributing to my tension type headaches. So a couple things that can really add into those tension type headaches. One is breathing, but two is processed foods. So eating a lot of processed food can actually cause us to have more headaches because it irritates the gut. And because, as we've learned recently, our gut is intimately connected with our brain. The next thing that can be causing tension type headaches, and I know you don't want to hear this potentially, but alcohol. So drinking alcohol affects not only the gut, but it can cause some dehydration. It can actually cause us to kind of go into that fight or flight response. There are some people that instead of it being a depressant and kind of calming things down, it's actually a stimulant and it actually hypes you up. It can actually increase your anxiety, which can throw you into that fight or flight response, which can then cause headaches. So for you, I'm going to ask that you consider, is alcohol one of your triggers that does cause your headaches? Now, this one, many people suffer from. Many of us feel like there's nothing we can do about it, but I'm going to encourage you to look at your schedule and deal with your lack of sleep. Because when you're sleeping is when you're healing your entire body, from your brain to your gut to every tissue in between. And we want to make sure that we're getting an adequate night's sleep to give our body enough time to heal. Now, there's huge controversy on how much is an adequate amount of sleep, but the idea is that you should wake up feeling rested and ready for your day. On average, this is between 7 to 8 hours a night, although I do know some people who do require 10 hours. Now, I will say I have met some people who feel like they can sleep 4 to 5 hours a night. They wake up, they're ready for the day, and they don't suffer with things such as headaches. And I'm not saying that that's not true for them, and that might even be true for you. But on average, what we found is that 7 to 8 hours is what the normal person needs on a daily basis. And of course, younger people and teenagers need even more sleep. A definite cause that I see a lot in the clinic for headaches is poor posture. Many people in my area tend to work on computers all day, and when you're on a computer all day, everything just starts to tank right down. Or some people will like sit on one side while they're on a meeting or on the other side, and then this can cause other types of problems too, including headaches. So I'm going to encourage you to watch your posture throughout the day, particularly if you perform repetitive tasks or if you sit or even stand for prolonged periods of time. I know a lot of people who have gotten those sit to stand desks, and so they have decided to stand all day long, which you would think is better than sitting all day long. And I guess it kind of is, but it's still being in one position all day long. If you have a sit to stand desk, I'm going to encourage you to switch positions every hour from sitting to standing, and that way you get that change in your body and different muscles are activating. But the thing is, with poor posture, if you don't have your head on top of your shoulders and your shoulders on top of your hips, what will happen is those muscles will have to work really hard to hold that head, well, in place. I mean, it's not where we want it to be, but they're going to have to work extra hard. When they have to work extra hard, they have to contract. When those muscles have to contract really hard all day long, they're going to get tight, and that can lead to a headache. Many people are surprised to find out that headaches can actually be caused by dehydration. Now, friends, dehydration is one of those really hot button topic issues, and people think, oh, well, I drink enough water. My guess is you probably don't drink enough water. So if you need a number to shoot for, I'm going to have you shoot for 80 ounces. And it is important that you measure that in some kind of way. So I've had patients go ahead and buy 80 ounces worth of water bottles, either one really big one or multiple ones. Usually works better because then you can kind of carry them around throughout the day. Whatever works for you, either way is fine. But make sure that you are actually measuring your water so you know what 80 ounces is to start with. Now, for my overachievers out there, what I'm going to recommend and what I truly believe is the best sign of health and proper hydration is to drink enough water so your pee is clear, and then drink enough water to keep your pee clear. Now, this is probably going to be more than 80 ounces for you, and it is going to be variable based on what you eat, but also how much you work out and what your daily rhythms are. But if you shoot for that goal, then I guarantee you, you're probably going to be pretty well hydrated. And the last thing that I'm going to mention that could be causing your headaches is it could be that the medication you're taking is causing these headaches. Now, there's a variety of medications that their second order consequence is that it can cause headaches. So I'm going to encourage you to look into that, to read that big sheet of paper you got with your medication to see if your headaches have started recently and you've started a new medication within the past 6 months, to go ahead and check out that document and see if that is what could be causing your headaches. So you guys know, if you've been on this channel for a while, that I always like to address the root cause. So that's why we started talking about all of those things, because the truth of the matter is I want you to deal with your headaches by addressing the root cause. I want them to just go away because you're treating the root cause. However, you can do all the right things and stay hydrated and have good posture and be exercising regularly and not taking any medications that are causing headaches. And sometimes headaches just happen because it is life and headaches are a thing. So next, I'm going to discuss what to do if you do find yourself with a headache, even after you've addressed all the root causes. So the first muscle we're going to work on is the temporalis. So that is found on the side of your head. It actually attaches into your jaw. And so we're just going to do some very gentle pressure through our fingertips to do some massage. Now, I like to do this with more circular motions when I'm on the temporalis, and this can help to decrease some of the tension. Usually this feels really good. And sometimes you can find a spot that's particularly tender. So I've got a spot right here on my right that's just feeling particularly tight, actually kind of shockingly tight. It's a little bit tender in there. And again, you're not putting a huge amount of pressure on there. This is a thin muscle. So it's not like a bicep or tricep where you got to like really dig in. It's a flat muscle. So just a little bit of pressure just to feel like you're getting a little bit of motion through there. And I'll usually spend about a minute or two, depending on how it feels. All right, so next up, we're going to work on the muscles that are right at the base of the neck. Those are called the suboccipitals. So you got your head bone right here. And if you can feel there's kind of a little ridge and then you fall off of that. So we're not trying to do right on the bone here. So you can feel bone underneath there. I tend to like to massage that, at least when I'm starting out, because it can be a really tender area that gets really inflamed with some massage. I want to stay on the muscles that are down here. So we're going to fall off that ledge and be right underneath there. And you can do both sides at the same time. I usually do, just because why not? I got two hands, we might as well do both sides. And I'm going to go in a kind of a crosswise pattern with this one, staying right underneath my cranium to really kind of get into those muscles. And you can go all the way along Now, when I get in the center, there's some increased fascia in the center there. It can be difficult to get anything happening right in the center. So I tend to stay off to the sides a little bit to stay away from that really, really thick fascia. With massage, we want to stay more on the muscles as opposed to on the fascia. Fascial massage is a whole different thing, and we really want to activate those muscles today and not aggravate that fascia. Hey, if you're finding this video helpful, go ahead and boop that like button for me. All right, now the next thing we want to do to activate those muscles is some active motion. Now, this can be really difficult because it's hard to stay in that pain-free range, but I do want you to go as far as you can in the pain-free range. So for active motion to start with, I like to start with rotation. That tends to be the safest motion. But again, you have to be careful that you're not pushing yourself into it. So when you're doing active motion, you should be able to turn from side to side in a nice slow pattern. Now, what you don't want to do is get to this point and be like, okay, that's pain-free, but I want to get all the way over here and really crank that neck around with the muscles. That's not what we're going for here, friends. We're going through a nice arc of motion as far as you can, pain-free, without getting a huge amount of muscle activation, just a gentle contraction and relaxation. Now, this last stretch that we're going to do is actually more of a pin and squeeze. Now, I don't recommend doing this exercise when you have a raging headache because it is one that is a little bit aggravating when you start it. So it can actually increase your headache if you really have that raging headache that's really, really aggravating you. So ask yourself, in all honesty, is it calmed down enough that I can handle this technique? Because this one's a little bit more aggressive than the others. So what you're going to do for this pin and stretch is you're going to grab the upper traps. So the upper traps come all the way from the cranium and attach down into the shoulder. So you can use kind of a big grasp to hold onto them. So you're going to grab them, kind of squeeze them, and that can kind of feel like a, ooh, that feels like it's doing something right there. And then what you're going to do is hold that really tight, and you're going to go down to the side as far as you feel safe and comfortable with. Now, right here, I'm getting a really big stretch. You might even be able to see it. This is a big stretch for me because my upper traps are pretty tight right now. So I'm just going to stay in that comfortable stretch range. Now, the problem is I see a lot of people doing is they're like, hey, if a little bit's good, then even more is better. No, because what happens is you grab those upper traps and you really push yourself to stretch, and that can actually cause a headache. In fact, I went once to a stretch therapy place before we started offering stretch therapy here at Physical Therapy for Everybody, and they did a really aggressive upper trap stretch. Now, my active range of motion, so if I'm just moving my upper traps, that's my active range of motion. But you saw when I grabbed it and I did that pin and stretch, you saw that that's all I feel comfortable with. That feels like a very aggressive stretch for me. Well, this stretch therapist decided basically to get me all the way over and then hold me there. And it was just too much. And I felt it at the time. And I was like, I feel like that's a little too much. And he's like, no, we're just going to be here for 5 more seconds. Well, the next day I had a raging headache because I got overstretched in my upper traps. So I cannot say enough. I want you to proceed with caution with that last stretch. I almost didn't put it in this video because I know that people can do too much of it. So I'm going to really ask you guys, be gentle with that. Find that stretch that feels like a good stretch, but not that increases your pain. Don't hold it for a prolonged period of time, just 1 to 2 seconds. Come out of it, and then you can go back into it. So you can do that grab, do that pin, stretch, hold to back to neutral. And you can keep that pin and then stretch, hold to, and back to neutral. But don't stay down there for a prolonged period of time. When your upper traps are that tight, like mine are right now, it's gonna cause increased pain and dysfunction. All right, so there it is, the root causes of what could be causing your headaches, as well as some things that you can do to address the root cause, and then some stretches that you can do if you find yourself with a headache. Even though you've addressed all the root causes, it still keeps coming back. I hope you found this video helpful. If you'd like more tips, I'm going to recommend that you subscribe to our channel and also check out my book, Movement is Life.